So welcome everybody to today's session. This is a OYES Sussex webinar, and today we're looking at health coaching. My name is Lisa Playford and I'm the engagement lead at OYES Sussex, and I'm here today with Harriet Hutchinson, who's one of our health coach leads. And yeah, so as explained, feel free to use the chat box for any questions you've got as we go through, or as we're a small group, just unmute and ask away. That's absolutely fine. And yeah, we'll also be using the react button as well today, just to try and make it a little bit more interactive for you and interesting. So I'm just gonna share my screen now. Can everybody see that okay? Yeah, you can see it lovely. So, yeah. So first of all, using those reaction buttons, if you want to give us a thumbs up or a thumbs down, we've got a couple of questions for you. So have you heard of OYES Sussex is the first one. That's good news. Brilliant. Yeah, obviously that's good. Yeah, so most of you have. That's good. So hopefully we will still talk you through some stuff you don't know. So we won't be sort of teaching you to suck eggs. Hopefully you'll still find it useful. And have you, the other question is, have you referred into our services before? Yeah, so one of you has. Yeah. Brilliant. Well, that's good. So hopefully we'll also cover how you can refer in as well in this session. So this is what we're going to cover today. I'll give you a brief overview of what it is we do at OneU, a little bit about each of the services, and then I'll pass you over to Harriet for the main event, which is a bit more of a deep dive into our health coaching services. And Harriet will talk you through sort of what the aims and outcomes of the services are, what the service offers, and you'll have an opportunity to ask questions as well. And then we'll also look at how you can refer in and some key contacts for you. So what is it that we do at OneUE Sussex? So putting it really simply, we help people to make small changes that can have quite a big impact on their health and well-being over time. And we try and take quite a holistic approach to lifestyle improvements. You see that menu on the right-hand side of the screen there. Those are the main things that we help people with. So obviously the big ones are stop smoking. So we offer stop smoking support, but we also help people to eat well, move more, drink less. And this are the sort of main pathways in our health coaching service. But we also can help people to lose weight as well in group or one-to-one settings. So those are the services we offer. We are commissioned by East Sussex County Council, and that's using public health funding. So we are separate from the NHS, and our approach is lifestyle rather than medicinal. And the aims of our service are to try and reduce the prevalence of those lifestyle risk factors that are associated with the morbidity and mortality of conditions that are linked to lifestyle risk factors. Ultimately, the aim is to reduce demand on health and social care services. So yeah, very preventative, very lifestyle focused, but we sort of look at everything within those areas and try and support people where we can. We cover the whole of East Sussex, apart from Brighton and Hove. They've got their own healthy lifestyle service, and we are based in GP surgeries quite often, but we're also based in lots of different community settings as well. And we also have a van called Colin, lovely camper van. I get to drive him all around the county into the high prevalence areas, into more higher areas of need, and he's really good for outreach because he's nice and visual, but he's also quite a useful clinic space. So we quite often do NHS health checks in particular on him. So I'll now just talk you through a little bit about each one of our services. So I just mentioned NHS health checks. So that is one of the things we deliver. And it's basically an MOT for your heart, putting it simply. So There's lots of lifestyle questions. Your height and weight's monitored. Your heart rate, your blood pressure, and it also involves just a little pinprick test. And we've got these special Cobus machines that can tell us about people's cholesterol. If it looks like there's risk factors for diabetes, we can also test for diabetes as well. And the whole thing takes 20 minutes to half an hour. And at the end of it, people get personalised lifestyle advice. They can get signposted into one of our services or other services if they need it. And those results are shared with GPs as well. So it goes onto their record. Yeah, so really useful. They learn the heart age and their likelihood of having a cardiovascular incident sort of over the next 5 to 10 years. So that's our health checks. For all of our other services, when people get referred to us, everyone's offered an initial health assessment, less detailed than a health check, but sort of taking that holistic approach. We have that initial conversation with people to find out what it is that they're trying to achieve, what their goals are, and we try and take a very client-led approach. So they'll have that initial assessment first, and then they'll get sort of triaged onto whichever service it would be most useful for them, and obviously checking they're eligible as well. So I'll talk you through each of those services now. So one of our main ones is stop smoking. So we take a sort of double-pronged approach with our smoking service. So you've got the behaviour change counselling, which helps people with that habitual side of smoking, but then we sort of approach the addiction side with nicotine replacement therapy on a reducing dose. And this is a 12-week program, and they'll meet with a stop smoking advisor weekly initially for the first 6 weeks, and then after that they'll meet fortnightly for a further 3 weeks. And hopefully by the end of it they'll have reduced right down to 0% nicotine, so they won't have the physical addiction, and they'll have learned lots of new techniques to break the habit of smoking. It's quite a successful program, and at each meeting as well their CO2 levels are taken to validate the results. So that's the stop smoking service in a nutshell. Another key service is our adult weight management service. Again, it's that magic 12-week program, because we know the behaviour change psychology tells us it's 12 weeks to change a habit, so that's why most of our programs are 12 weeks. And this can be offered either one-to-one in health coaching, which Harriet will tell you more about, or in small group settings as well for that peer support. It's not a faddy diet. It really is about sustainable, manageable lifestyle changes over a period to achieve weight loss. So it covers all sorts of topics, sort of, supermarket tours, how to avoid the, buy one, get one free on the naughty stuff, the effect of sleep, the effect of movement. It covers a whole range of issues, snacking, all sorts of things. It's really useful. We've also got a branch of that aimed specifically at men, which is called Man v Fat. And that is six-a-side football, and the matches are actually decided on weight loss of the team as well as goals scored. So that's quite successful. Seems to tap quite well into that competitive nature that a lot of men have, well, and women. But yeah, so that's the adult weight management service. We also offer free training for our partners in the community and health sectors and voluntary sectors. Making every contact count is the main bit of that offer. I don't know if you've heard of that before, but it's national initiative by Public Health England, and it's about having conversations with people and using those conversations you're having anyway, that we're all having, to help direct people into sort of positive, healthy lifestyle change. It's really, really interesting, useful training. So we can deliver that for free if you've got any interest in that for your service. It's pretty relevant for anyone that's customer facing, actually. We also can train people up in how to do health checks and how to use the Cobus machines that are used for those. And we can also offer stop smoking advisor training as well, on request. We've got a training page on our website, and yeah, all of the upcoming trainings listed on there, and that's listed on the slide here for you. I will share these slides with you as well, by the way, after the session, so you'll have all this info. Another thing we've done just over the last year is get involved in the establishment of the active Eastbourne and Lewis partnership. So there was already an active Hastings and active Robber partnerships, and there was a bit of a gap there in the Eastbourne and Lewis areas. And so East Sussex County Council asked us to help establish this partnership, which we've done. And interestingly as well, we're actually just about to start establishing active Wilden as well, because there's a gap in that area. So watch this space for that. And the aim of that partnership is bringing all the different sort of healthy lifestyle providers together to share good practice and network. But it's also so that there's a directory of what's happening and where that people can join in with. So if you had a client that was looking for armchair exercises in Seaford, for example, you'd be able to go on and look that up on the active Eastbourne and Lewis website. And the overarching aims of that is to increase access to physical activity and sport in the Eastbourne and Lewis areas, to improve health and wellbeing. And obviously you've got that whole networking, strengthening local partnerships and connections side of it as well. And that's been really successful this last year. Yeah, so that's a whistle-stop tour. The only thing to add to that is that our parent company is called Thrive Tribe, and we've also got a really comprehensive digital sort of online support package called Glogy. So if people, perhaps if face-to-face doesn't suit people so well, perhaps they're working, perhaps they can't make daytime clinics, people can actually access Glogy Digital online. It's a bit more self-led, but they can also have weekly phone calls with a health coach, and that covers all of those pathways that I've spoken about. So there's Glogy Smoke Free, there's an online gym called Glogy Gym, and there's a general Glogy sort of health coaching, which covers, eating well, moving more, all of that stuff. So yeah. So that's my whistle-stop tour for you. As I said, we will share the slides. So I know it's a lot of information I've just gone through, but we will share it with you. But I'll pass you over to Harriet now, if that's all right, Harriet.
Lovely. Yeah, of course. Thanks, Lisa. Hi, everyone. So as Lisa mentioned at the beginning, I am one of the leads for the health coaching team. So I look after all of our wonderful health coaches in the East Sussex area. So I'm just going to give you a little bit more of a deep dive, bouncing off of what Lisa has already spoken about, just specifically looking at our health coaching pathway and what we can offer to our clients. So as you can see here, we started in 2017, and the aim of the health coaching service specifically was to be able to offer personalized one-to-one health coaching guidance and support. So we're really wanting to offer more kind of a bespoke service to each client, just fully acknowledging and recognizing that each client will come in with complicated lives, lots of different goals, particular things that they can and cannot sort of commit to. And so the idea is that they would build a relationship with their health coach over the 12-week program, and the health coach will work individually with that person to just help them to achieve the goals they've come in with, really. And ultimately we want to just be seeing and improve lifestyle factors for them at the end of those 12 weeks. And as you can see just on this slide, in the last 8 years, we've helped over 2,300 clients improve their health outcomes. And we're seeing roughly around 50% of clients achieving their goals at the moment, which is really fantastic considering, clients have got very busy lives. There's lots of kind of other factors that come into play with that. So we're really proud of that, and obviously wanting to increase that percentage every single year. Can I have the next slide, please, Lisa? So just another little interactive question. You can either pop your answers in the chat box or just unmute if you're comfortable to do that. So do you have any idea what the current percentage of overweight and obese adults is in the UK? Oh, we've got some typing. 40 to 45% from Josephine, 30% from Amanda. Anyone else want to hazard a guess before I give you the answer? So at the moment in the UK, we're actually looking at a percentage of 65% of adults are either in the overweight or obese category. So that's 20, a BMI of 25 or above. So as I'm sure you'll agree, services like ours are actually really vital. It's not just kind of a nice thing to have. Like it's so, so important because especially for you that are healthcare professionals, you're obviously, as Lisa mentioned, you're seeing a lot of these clients with these preventable conditions that just by changing a few lifestyle factors, hopefully they won't then actually get to the point of needing to see a healthcare professional, and actually we can really support with that preventative care, which is going to make a huge difference not only to the NHS but to the lives of the individuals as well, and that's really, really what we care about. And just kind of on the bouncing off of the back of that question, then how much do we estimate obesity related conditions cost our NHS per year? Anyone want to hazard a guess? Billions? Yeah, you're not wrong there, Josephine. It is in the billions, sadly. Yeah. So it's actually £6.5 billion per year that obesity related conditions are costing the NHS at the moment. And that's everything from heart disease all the way to cancer, everything in between. And that's obviously the only ones that we are kind of aware of as well. So yeah, it's really kind of staggering figures there, but I'm sure, working together, we can start to make a difference and hopefully start to see those numbers come down. So this next slide here, I realise these names won't mean anything to you, but these are all of our health coaches. And as you can see, we cover a huge range over East Sussex, and we're always trying to branch out into further areas as well. So at the top here, Harriet and Mike, that's myself and my colleague Mike, we look after the health coaching teams. And then as you can see, we've got coaches in Eastbourne and Hailsham, Bexhill and Hastings. We should also be opening a clinic in Rye soon as well, but that's kind of TBC at the moment. We've got someone in Seaford, in the Haven, so covering New Haven and Peacehaven, Lewis, and then High Weald as well. So we're covering a really, really wide range of areas in East Sussex, and as I said, always wanting to expand further as well. We do also have a couple of health coaches running remote clinics as well, which is phone clinics. And that is specifically for people who are housebound or who don't have a clinic in their area at the moment. So if you do have any patients or any clients that you think might be suitable, but actually they can't get to a face-to-face clinic, please don't let that put you off referring them. Please do get in contact with us anyway, and we may be able to put them into a remote phone clinic. Thanks, Lisa. So what we offer, obviously, I've explained a little bit already, but just to go a little bit further into detail. So the model that we use is called core behaviour change. And essentially what this is over 12 weeks, we offer the one-to-one intervention with tailor support to suit the client's goals, lifestyle and capacity. And I think capacity is a really key word there as well. We want to make sure it's not a kind of one size fits all approach, but we're really looking individually at that person. They will have fortnightly sessions with a coach, and that includes nutrition and physical activity information and behaviour change support. Just to be clear, we don't offer specific nutrition advice or specific personalised exercise advice. We're not kind of nutritionists or personal trainers, but what we do is offer in line with NHS guidelines and that Eat Well plate and all of those things. We want to offer nutrition information and physical activity information. We set primary goals with the client. So as Lisa mentioned at the beginning of the presentation, the 4 pillars that we look at are eat well, move more, lose weight, and drink less. So when a client comes in for that initial session, we will ask them which area they would like to focus on. Now, they may want to focus on 1 or 2 of those pillars. We try to encourage to sort of stick to 1 or 2 to begin with so that it doesn't feel overwhelming. But for example, the lose weight and the eat well pillars tend to go quite well together, and the same with the lose weight and move more. They tend to go quite well together as well. The drink less pillar is a little bit more nuanced. As I'm sure you can appreciate, we have to kind of be quite careful with whether or not that client is appropriate for our pathway, or whether they need more specialist advice, for example, from services like CGL. So we we kind of, that one is a little bit more nuanced, but we can absolutely support clients in drinking less if we feel that they're not alcohol dependent and actually it's just about cutting down. And our coaches also do offer smoking cessation as well. So my teams in particular will do both. They'll look at core behaviour change and they'll look at smoking cessation. And as Lisa mentioned, that's a 12-week programme, one-to-one smoking cessation, which includes free nicotine replacement therapy products, which is a real appeal for a lot of clients, particularly because they are so expensive. So they can come to us and they will be given free products to help them on that journey. So that includes things like vaping, nicotine patches, gums, and nicotine sprays as well. Thanks, Lisa. So we do have eligibility criteria for this one. So clients must be over 16, and that's actually 12 for smoking cessation. We can see clients from 12 years old for smoking, but anyone for our core behaviour change pathway must be 16 or over. They can't be pregnant or breastfeeding. Now that doesn't count for smoking. We can see clients who are pregnant if it's smoking cessation, but for our core behaviour change, because again, the nutrition advice is different around pregnancy, unfortunately, we aren't able to see pregnant clients at the moment, but we would just refer them back to the GP for more specialised support. We aren't able to see clients who have any diagnosed eating disorders, again, because that's just a very kind of specialist area and not something that we are kind of able to offer advice with. And in order to start seeing a health coach, they must have had an initial assessment, as mentioned by Lisa, with one of our health coaches. And that is just to check that they obviously need to be made aware of any serious comorbidities, anything that may make their sort of journey with us a little bit tricky. So we just need to make sure we've done that just for safeguarding purposes to make sure that we're looking after the client as best we can. So another little question for you. So why do we think that we have these kind of specific elements to our eligibility criteria? Feel free to use the chat box if you'd prefer to not to talk, that's fine. I also did kind of answer the question already, didn't I, when I was explaining it? I gave you the answer. I forgot this slide was here. Oh, I see someone typing. That's great.
Yeah, sorry, I realise I can't actually see the chat box while I'm
That's okay.
sharing my screen.
I can see it. That's fine. I can keep an eye.
Yeah.
Just while we're, oh, here we go. Yeah. So prevent harm and to ensure commitment. Yeah, that's fantastic. That's exactly it. We just want to make sure that we're being as, we're safeguarding clients as best we can. So we just want to make sure that we're not taking anybody that we wouldn't be able to support safely. And also from a kind of practical point of view, we do have very specific guidelines from our commissioner, from the council as well. So we want to make sure that we're kind of in line with those. But yeah, it's mostly just to make sure that we aren't being unwise with who we're seeing and the information that we're giving, making sure that it is safe to be able to give the information to those clients. And then what might qualify as a serious comorbidity where a referral back to a GP might be necessary? Are we kind of clear on those serious comorbidities? If not, I'm very happy to go through those. Yeah, kind of clear on that, put a thumbs up. So just to kind of to make that clear to anyone who might not be, so things like serious kind of kidney disorders would be one of those, just because the nutrition guidelines again would change for someone with a kidney disorder. For example, the 5-a-day messaging isn't appropriate for someone with a kidney disorder. Things like very serious liver disease, as I mentioned, eating disorders. We can see people that are going through cancer treatment. That's absolutely fine. Again, we may ask them to also refer back to their GP just to make sure that we're kind of they're being looked after in both both sort of senses. But yes, that is fine to be seeing people that are going through cancer treatment. But it's really any comorbidity that may alter the generalized nutrition advice. We wouldn't want to be giving that general advice to people who have got very specific disorders or conditions that, you know, then we could be worsening those conditions or affecting those conditions. Is that okay? Is everyone happy with that? Lovely. You can also, if you're not sure, please just give us a call or email us, and then we can absolutely advise on whether or not we're able to see a specific patient or client. Lovely. Thanks, Lisa. So, as I mentioned, obviously, you know, it's costing the NHS a lot of money with these particular lifestyle related diseases. But some of the reasons why services like ours are so important is because, as I'm sure you're already aware, you know, when people are in the overweight or obese category, when they are not necessarily following a healthy lifestyle in terms of eating well, exercising, limiting alcohol, maintaining a healthy weight, we have got an increased risk of so many in conditions, diseases, etc. So things like metabolic syndrome, so diabetes, etc., respiratory conditions like COPD, certain types of cancer are related to lifestyle, overweight and obesity. We've got other conditions such as arthritis, gout, gallstones, and it does also affect mental health in clients as well. So even things like emotional eating, self-esteem, stigmas, judgment, self-doubt, all of those things can be very, very closely linked to lifestyle factors. Fatigue, often combined with sleep disorders. We see a lot of clients with sleep apnea related to being overweight. And then obviously longevity as well. We want to make sure people are living long and healthy lives. And so actually supporting them with these lifestyle habits and behaviours can really, really help with that. Thanks, Isa. So our service needed in East Sussex. So again, just some more quite staggering stats for you. So 63% of adults in East Sussex are now classified as overweight or obese. So that's not nationwide like the previous stat. This is just in East Sussex. 21% of adults are considered inactive. So that is doing no to very, very little movement. Over 25% of adults, again, just in East Sussex, are estimated to drink more than the recommended weekly allowance of alcohol. And 35 to 39% don't meet their recommendation of the 5 a day. So our aim is really to help our clients to improve their health and to live more comfortably and to lighten the pressure on NHS resources, as I said earlier, which now estimates at 6.5 billion per year in obesity related admissions and conditions. And we've just got some lovely testimonials to end my little section of the session today. So Lisa, age 24, said that she found it very helpful and reliable. The benefits of have been having support every week where I've needed it and someone understanding to talk to. And actually, we've really found that a lot throughout lots of clients' feedback that for them, it was actually just about having that accountability. They sort of knew what to do. They knew what the sort of things to be put in place, but knowing that somebody was going to ask them about it really gave them accountability and that push to make those changes. So actually, the health coaches and their services are really invaluable in that respect. And we've got another one from Isabella who said, excellent, really, really helpful. It has changed my life and my health so much for the better. I wouldn't have been able to achieve my goals without the help and support of my health mentor. So a really glowing review there. And we have lots of wonderful feedback every single week from clients who often are just really glowing about their coaches. And we're very fortunate, Lisa, I'm sure you'll agree, to have some really passionate coaches in place who just love what they do and are just so passionate about helping clients and really caring about that individual that's in front of them. So
yeah, it comes across a lot in the feedback, doesn't it? About that.
It does.
That relationship with the coaches really is sort of quite key to success.
Absolutely.
Yeah.
Often we do hear that as well, actually, that people, you know, even if they're having a bit of a week where they're a bit unmotivated, just the relationship with the coach has kept them going because they've not wanted to let their coach down. And so they've wanted to kind of push through and push themselves to make the change they said they were going to make because they didn't want to kind of, yeah, disappoint their coach. So it's really great having that personal relationship over the 12 weeks. Yeah. Lovely. Back
Lovely.
to you, Lisa.
Yeah, thank you. Thank you. So yeah, it's really, really easy for people to refer into us. So that is a screenshot there that you can see of our home website page. And in the top right-hand corner, there's the Get Started button. So people can click on that, and it takes you to a referral form, which literally just asks basic contact information and what they're interested in initially. Takes about 2 minutes to complete. People can self-refer. Or professionals can use that button as well to refer their clients. And then after that, what happens is our support team, who's led by Anthea, that they aim to get back to people within 5 to 10 working days. It's usually pretty quick, actually, that they're really good. It's usually a couple of days they get back to people. And then that's when they'll start that conversation around what it is they're interested in and book them in for their initial assessment. So that's one route. The other route is you can just call us. So the number's there. We're based in Eastbourne, so it's 01323 404 600. Or that's our generic email address as well. They're hello@oneuesussex.org.uk. Also, if you are a health professional, you can actually make a referral directly via your systems. If you just search for stop smoking or lifestyle support, one you should come up and you can refer directly to us. And we've got one of the secure NHS emails, and referrals can come in that way. So it couldn't be easier. Yeah. So yeah, so that's the main bit of our presentation for you today. Does anybody have any questions at all? No, we've covered quite a lot of ground. Because the only thing I'd add that we do get asked sometimes is that we don't provide medication for any of our services. So we don't issue the weight loss injections, for example, or Champix for stop smoking support. So we're not the medicated route. We are the lifestyle support route, and we'd be referring people back to their GP surgery if they're interested in medication for these things, to check with their GP if that's available when they're eligible. But yeah, so that's a question that comes up a lot. The other thing we quite often get asked is about vaping. That's quite often a hot topic and in the media and stuff at the moment. And yeah, at the moment, obviously, we do follow the clinical guidelines, and it is still considered to be one of the most effective, safe forms of help with smoking cessation support. So we do provide vapes, but only to over 18s and on a reducing dose, only as a quick tool. And we don't offer vape support. We are increasingly get asked, can we help people to quit vaping? And actually, at the moment, we're not commissioned to help people quit vaping just yet. Although we suspect that might be something that we're asked to do in the future. But currently, people do have to be smoking at least some of the time to access our support for stop smoking. Yeah. But does anybody have anything else from anything that we've covered?
Claire, I've just seen your question in the chat. If you can just bear with me, I'll just quickly get up our clinic list. The Lewis support is one-to-one coaching. I'm just trying to remember off the top of my head how often we're in Lewis. I'm just going to quickly check that. If anyone else has any questions. Oh, I've just seen Claire's put another question. I've lost my screen. Can you send some of your little cards, please, to give out?
Yeah,
Have we got any
absolutely.
of those, Lisa?
Yes, yeah, absolutely. If you want to pop your contact details in the chat box, then I'll revisit that and make sure I send you out a resource pack. No problem.
Lisa,
Yeah,
Josephine has also just asked if we can send out where all the clinics are. I wonder if it would be helpful if anyone else would like those as well, like the specific venues as to where clinics are. If you're happy to put your email address in the chat, then we can send you the information as to where specifically they are.
yeah, no problem.
Trying to get access to this clinic list, which is not letting me in.
We will share these slides as well. I'll just share a couple of while Harriet's looking up the clinic list. I'll just share a couple of key contacts with you. So obviously, you'll have Mike Church is the other health coach lead in the team. So you'll have his email address and mobile number. And again, there's Harriet's and there's mine there as well. So I manage the engagement team, and so if you ever want anybody to come along to your setting and give you a service overview for your team, or you'd like us to do a sort of pop-up for your staff or clients just to give a bit more information and be available, we're always really happy to do that. And again, if you feel like the MEC training, the Making Every Contact Count training, might fit nicely into one of your team meetings or something, then and would be useful, then again, get in touch and I can arrange that. And also just to add that we do have 2 dedicated contacts for primary care colleagues. About 50% of our referrals come from primary care, from GP surgeries and other really frontline services. So that's why. So you've got Lorraine, who covers Hastings, Rother, Bexhill, Havens, Wilden, Seaford, High Weald and Lewes. So the majority of it, she works 4 days a week. And then you've got Koa, who works 1 day a week, and she covers Eastbourne, Helsham, Polegate and Stone Cross. And they're a dedicated first point of contact for any of our colleagues working in primary care.
So we are for Lewes, the question around Lewes, we're in Lewes Family Hub on a Wednesday. That's useful. And that's a one-to-one coaching, that's one-to-one clinics. So no groups there on a Wednesday. Clinics in Newhaven and Seaford, Josephine. Yeah, so we'll send out the clinic list, but they are at the moment in the Horder Centre in Seaford, and there's a few in Newhaven. There's Newhaven Rehab Centre, Chapel Street in Newhaven as well. Think that might be it for the moment. Yeah, but we'll send out the details of all of them, and we'll send out the details of the clinics in Bexhill as well. That's fine.
So a couple more questions for you to consider. Now, I guess we want to check that you got out of the session what you wanted to. So do you feel you know what our health coaching service offers now? If you want to give a thumbs up or a thumbs down, that would be brilliant. Yeah. Oh, do you have a question, Claire? That was a thumbs up. Okay, no yeah, so everybody's, yeah, if you've got any questions though, and if something occurs to you later on, please do get back to us and we'll help if we can. And do you feel you know how to refer into our service okay now? Lovely.
Great.
Brilliant. Thank you. Job done then. That's good. That's good to know. So we have got a little feedback form here. If you've got a couple of minutes, we'd really appreciate if you have time to fill that in. Just because we're probably going to run a series of webinars again for the coming year. And if we can tweak them and make them even more useful for you all, that would be really helpful to have the feedback. Thank you. Are you all from primary care settings attending today, or are you? You are? Yeah. Yeah, most people that have attended have been. So we've sort of geared them that way. But yeah, but that's it. So thanks so much for attending today. We're very pleased you joined us. And yeah, and we will send the slides out. I'll also send the feedback form link out if you haven't got time to do it now. We'll send out that clinic location list as well. And if you've popped your contact details in the chat box, I'll also send you out a resource pack with the cards in. Yes.
Sorry, Lisa, just to jump in before we finish as well. If you're all in primary care settings as well, we are always interested in, as I said, kind of expanding and going into new venues and new sort of placements. So if you feel that there might be capacity within your settings to have a coach in, if you've got a spare room or anything and you'd like us to come in, then we're always really, really happy to hear from you. We're always looking for new spaces. So please do get in touch and let us know if there is anywhere that you think we'd be suitable for. That'd be fantastic.
Brilliant. Right, well, that's the end of the session. Thank you all very much for joining. Take care and have a good rest of your day.